Staying with schools, a report from the Kenya Medical Research Institute now shows that learners from the Sacred Heart Mukumu girls admitted to hospital were suffering from gastroenteritis and amoeba infection. Health Cabinet Secretary Susan Nakumicha and Education Principal Secretary Belio Kipsang were on a fact-finding mission in Kakamega, where two schools have been closed after the death of 2 students. With more is Zakias Mwasame.
Health CS Susan Nakumicha, who was accompanied by Education PS Dr. Belio Kipsang, visited Kakamega Referral Hospital, where a majority of the girls from the Sacred Heart Mukumu girls are admitted.
Killing of the toxin the body responds by.
Results from KEMRI indicate dominance of Salmonella typhi, a typhoid-causing bacteria, in the samples taken from the minors.
So we have noticed that a total of 108 cases of gastroenteritis, which is a stomach disease, and it has resulted into 2 deaths so far, which have been reported. A majority, 68 of them, were managed as outpatients, with only 40 being admitted. To date, 26 of them are still admitted, 14 have been discharged. Of the admissions, 9 of them are at the Kakamega Referral Hospital, and I have been there. I have seen the 9 girls, and 17 are at Mukumu Mission Hospital. 1 student who was critically ill from that number had been taken to ICU. From there, yesterday, they were in HDU. And as of this morning, they were now discharged to go to the general ward.
Reduce the impact that we are putting on the environmental issues. So on the school issues, we shall address them. Our team, led by the Regional Director of Education, will be coming back through a multi-agency team, which will be led by the Regional Commissioner, having all of us as government, Ministry of Health, Ministry of Education, and many others that the CS will guide us on in a short while.
The CS reiterating that her ministry will work hand in hand with the county governments to check on the quality of food supplied in schools.
We have reviewed our guidelines, and they should be shared with the schools in terms of how to manage their food. But we are also working together with the county governments in terms of inspection of facilities that handle food. Also in terms of testing the food handlers, like the cooks who work in the school, we are working with the county government to ensure that they go through proper testing and they are issued with certificates after being verified that they are okay to handle the food.
Earlier, Mukumu Girls Principal Frida Ndolo had rough time explaining to the officials why the school kitchen was in a poor condition.
Like the kitchen area, it wasn't very well done. And we have told the principal, Madam, who is here with us, that that is within her purview. She has no excuse but to manage the hygiene and sanitation situation there. Similarly, the tables being used in the dining, I'm told they're supposed to be either steel or with formica that is easy to clean. We notice that that is not what is on the ground.
26 girls from Sacred Heart Mukumu girls are still hospitalized, while all the 97 cases at Butere boys have been discharged. Zakias Mwasame, NTV, Kakamega.